Superbugs crawling their way out of hospitals, says study. Why the margin between community-acquired and hospital-acquired infections is becoming too less? What is antimicrobial resistance? Why has resistance developed? What can be done immediately to reduce the amount of resistance? What are the consequences if nothing is done to fight superbugs? GS Paper 2 Issues related to health, education and human resources. What is the context about? Drug-resistant strains that have a high mortality rate are now spreading to people who have had no contact with any healthcare center for over 3 months, a recent study has revealed. Earlier, the cases of these drug-resistant strains were usually seen among people that had recently been to a hospital. The distinction between community-acquired and hospital-acquired infections is becoming increasingly blurred. Why the margin between community-acquired and hospital-acquired infections is becoming too less? The distinction between community-acquired and hospital-acquired infections is becoming increasingly blurred. The main reasons for this are the spread of classically hospital strains, particularly resistant Klebsiella and E. coli, into the community and vice versa. The repeated admission of individuals to hospital with long-standing underlying diseases. What is antimicrobial resistance? Antimicrobial resistance, commonly called AMR, is when bacteria, virus, fungi and parasites become resistant to the drugs typically used to treat people infected by them. The drugs which previously would have cured people of an infection are no longer effective in killing the microbes. These resistant infections are often called superbugs. Infections such as HIV, tuberculosis and malaria are becoming increasingly untreatable because of antimicrobial resistance. It basically compromises the whole of modern medicine. Why has resistance developed? There are many reasons underlying why resistance has emerged so widely among infectious microbes. Like any other living organism, bacteria can mutate as they multiply. When antibiotics are introduced, only the bacteria that can resist the treatment can survive to multiply further, proliferating the line of drug-resistant bugs. The rapid replication rates of bacteria, virus, parasites and fungi mean their turnover is high and they are able to quickly evolve past a problem they encounter, such as a drug that is trying to kill them. But human behaviors and practices have helped these microbes evolve faster and more strategically than they otherwise may have. What can be done immediately to reduce the amount of resistance? It's not too late to reduce the amount of resistance if individuals and governments alike commit to tackling the problem. New antibiotics are needed to take the place of those that have been redundant, but experts warn that this can take decades, so amending current practices is an immediate priority. What can individuals do? Wash your hands more regularly to avoid both contracting and spreading infections, especially when visiting people in the hospital. You can also spread the word and help others become more aware. Ensure that you finish any course of antimicrobials prescribed to you. Avoid sharing any drugs prescribed to you. What are the consequences if nothing is done to fight superbugs? Today, superbugs are estimated to cause 700,000 deaths every year. If no action is taken as laid out, these numbers are expected to rise to 10 million deaths each year by 2050. Treating cuts and wounds could become problematic due to the risk of untreatable infections, and easy-to-cure infections such as gonorrhea will be rendered untreatably. Childbirth and procedures such as cesarean sections, organ transplants, wound treatments and other forms of surgery will become high risk as doctors lose to access antimicrobials. The world will move back to pre-antibiotic era. If nothing is done, the last drugs standing will be knocked out of the game, and modern medicine will not be so modern.